Awesome. All right, everybody. So this is our very first of hopefully a good bit of series that Complete Kids will be doing in hopes to help educate, bring people together in a community. And this is all about post-referral service. So you've been referred. Now, what is the process? So we're going to go ahead and introduce everybody. My name is Miranda Wood. I've been with Complete Kids for about 2 years. I'm on the marketing side and I have just loved it. I'm going to introduce Dr. Daniel Wells. He is our in-house psychologist, and he will be covering everything from the autism evaluation, what to expect, what to bring post-referral. And then we'll go to Ruchi Patel, who is one of our BCBAs. She's at our Burlington, North Carolina clinic. She has been here for quite a long time as well, and we love having her expertise educating all of our families. So first, what we'll do is if you guys in the chat could let us know why you're here, who are you representing? Are you a parent, a referral coordinator, a pediatrician, legal guardian, or other? So we know who we're talking to and how we can address your concerns. As the time goes on, we will ask you to keep your mics muted and your cameras off. We will answer all questions in the last 15 minutes of the video. And if we do not get to your questions at the very end, we will address them as we follow up with a recording of this so you can go back and relearn all over again. So like I said, we'll have about a 45-minute initial presentation with Dr. Daniels and Ruchi, and then questions and answers the last 15 minutes. Please keep everything muted and cameras off throughout the initial presentation, and we will do our best to address all questions. A recording and a transcript of this presentation will be provided at the end, and you should receive that via notification, email, or text. All right, so I'm going to go through a little bit of housekeeping on who Complete Kids is. So Complete Kids is a largest pediatrician service provider in North Carolina. We actually started right here in Gaston County, which is not too far from Charlotte. So we provide all four services in-house. We provide ABA, so applied behavior analysis therapy, physical therapy, speech therapy, and occupational therapy. We do all of these in one location to make it simple and easier for our families and for our child, as we like to do a whole child approach. The goal of this webinar is to explain a little bit of what ABA therapy is. If you're just now starting in this community, it can seem a little daunting, and we want to make sure our families feel well educated and in the know of what is going to be happening in the foreseeable future. How to get started once your pediatrician sends a referral to our staff and what those first steps look like, what to expect along the way. We hope that you gain understanding of the process, making it easier for you all in the forthcoming weeks. And we hope to build skills, confidence, and give every child the bright future that they deserve. And here I'm going to go ahead and send this over to Dr. Daniel Wells. Thank you so much for being here, and I appreciate your time. Go right ahead.
Thanks. Well, thank you so much for letting me be here and talk with you today. Again, my name is Dan Wells. I'm one of the psychologists here. We have a team of psychs kind of all over the state that do a lot of these initial evaluations for our kids who are thought to be showing signs of autism. And so I think my goal here for today is just to get you to know what to expect from that evaluation and what kind of information we can provide and kind of how to get you set up and started on this path towards supporting your child the best way that you and we know how. So I wanted to back all the way back up. And so probably, again, we're talking about we've already received your referral. I wanted to just review kind of what happened here prior to the referral getting placed. And so, the first step was that you started as a parent or maybe as a service provider, we started to see some concerns with the development of your child. And we know that we want to address those concerns quickly and with reputable sources and with people who kind of are familiar and comfortable in talking about those concerns, like a good pediatrician. Hopefully the pediatrician will provide some good context as to, is this a concern? Is this just a phase? Is this just a personal difference? Or is it something more, something that we've got some developmental delays that really are worth investigating? We can do that with data. We can do that with the pediatricians doing some observations. But that's a great person to be the first point of contact to say, hey, what's going on? And they can point you in that right direction. And so that gets us then to the referral. And so here at this point is kind of when your journey with Complete Kids or really with any other ABA company gets started. I do want to pause and say, our goal here is to certainly Complete Kids is proud of the services that we provide, and we want to offer those services when appropriate. But I think our goal is to speak broadly about the process of ABA therapy and how is this going to work anywhere. And so hopefully you'll choose us to walk this path with you, but we want to give you information that are going to set you up broadly. So for us, and I think broadly, the first step is going to be uh, an admissions team, some administrative staff that review referrals to see is this a referral appropriate for our company or any company. Different companies are specializing in serving different populations, whether that's different age ranges, severity levels, different kind of comorbid or multiple disability styles. So there are things that our company is really good at. We are a pediatric company serving ages 2 and up, probably through 10 to 11 is about when our clinics. We'll talk a little bit different about some in-home services that might broaden that age range a little bit. But so we want to make sure that the referral that we received matches what we are able to help with. Um, the next step, if that referral seems to be something that we can help, you'll get a call. You'll get a call from our admissions department to explain what our services can be and what some of the next steps are. If you as the parent or the parent is interested in those services, at that point we will check their insurance to say, we know this as with any medical service and therapy, getting insurance on board is going to be an important step. So that's all stuff that happens kind of behind the scenes as we prepare for this initial meeting. Again, our goal is to talk about um, the therapy or the evaluation process in general and what's specific to ABA and Complete Kids. So I want to take a moment to kind of highlight the different types of evaluation that are available through us as well as kind of in the community. Obviously, we are not the only psychology practices. So what would the difference or the unique things about an evaluation with Complete Kids look like versus someone else, some other practice? In general, we're going to be in these two camps. So we can do, if you are referred to a general psychology practice, those evaluations are really good at exploring and diving really deep into the concerns that we have about children of a broad range, children and adults. A general psychology practice is going to be a general service. Um, Now, sadly, we know that the evaluation wait times for that type of service can be pretty long. And because they're diving so deeply into lots of different things, the time to complete that evaluation and to provide feedback for that evaluation sometimes can take a little while. There's a lot of things to go over and to how to get to know a whole person like that. For ABA companies like Complete Kids, we try and be a little bit more streamlined in our evaluation. And so for our referral providers, we are targeting primarily those questions related to autism. Again, that's what we specialize in. That's what we are good at understanding and providing help for. And so that's kind of where that's where we do our bread and butter. When what that allows us to do is to hopefully be a little more quick in our turnaround. We can get people in quickly. We can get feedback quickly. Um, but we also don't want to give the impression that we can do that deep dive into something that we're not given the time or the resources to really do that whole comprehensive. And we can certainly refer to places that do that more comprehensive. But to answer an autism related question, we are really good at that, and we would love to help your child if that's a question that really needs answering. So we have done our referral, and you have received your call, and during that call, the admissions team member has said, "We are ready to schedule. When would you like to come in?" Um, Obviously, there will be some limitations to when the providers are available. We would love to see everybody exactly when works best for them, but limitations exist. So when you're scheduling, I think some important things for you to consider as you know your child. First of all, when are they most engaging? If we have a young child that's still napping, maybe scheduling an evaluation over nap time wouldn't be the best idea. Um, we know we work over meal times and that type of stuff. So we have snacks or things that can help the child feel more comfortable during that session. Certainly, there are things outside of that child that a parent is responsible for. I know we've had several situations where we sit down on the appointment and they're like, "Oh no, I need to get my kids picked, my other children, my other siblings picked up from school." So coordinating those types of things are certainly something to consider. Um, we also want to have good impact, input, and participation with all of the support people for that child. Um, our requirement legally is that at least one legal guardian be present during that evaluation. But we also want to hear from grandparents or other people who know that child well. Take a pause to talk about siblings. We are happy to do an evaluation with siblings present. Siblings, as any parent will know, have good moments together and not so good moments together. And we do certainly want to be focused on the child that is being referred and be able to go deeply into what their needs are. And sometimes siblings can be make that more challenging. So if possible, we ask that siblings stay home, but that's never going to be a reason why you were turned away or said that an evaluation is not possible. Also wanted to talk a little bit about medication. This is a question that'll often come up from our parents is maybe my child's already been diagnosed with ADHD and is getting some medication to help manage that behavior. Should I give it to them? Do you want medicated or unmedicated? Our first and best answer is it's a parent decision, and please involve your medical team in that decision. There are medications that need to be taken consistently or they lose some effectiveness, and we don't want to get in the way of changing medications just just randomly. But we also are here to see and observe the behavior challenges of the child in that session. And so it is perfectly fine and sometimes helpful to see behaviors as they really are. And being able to observe and discuss those is really important. So um, again, in summary, always a parent and medical team decision, but don't be afraid to bring them as they are, and we like to get to know them. Um, so now you're scheduled. You've got a date on the calendar. You've got a time to come. And what comes next? What can we do in the meantime? We know that waiting is hard. That obviously you've come to us because maybe some things are challenging and some days can be long. And so we respect that we want to get you in and seen and helped the best way we can as soon as possible. But we acknowledge that wait is a real thing. In the meantime, one of the first and best ways to keep up with our company in particular is through the Cure app. This app is what we at Complete Kids use to communicate with our families, to establish and provide reminders for scheduling. And if and when future therapy is provided, it'll be an ongoing way to keep up with your child's progress. So as soon as you're scheduled, downloading that app is going to be a great way to keep in communication with us. As you prepare for the evaluation, you will also be sent a certain amount of paperwork. Um, some is administrative, just the can you sign the admissions and enrollment paperwork for the evaluation. Those questions are going to be a lot of some background information, but also just understanding company policies and procedures. So you're aware of kind of what we as Complete Kids or any ABA provider is looking to do for your family. The other paperwork is more clinical. So some behavior rating scales that can be filled out at any time, and filling them out before the evaluation really helps me as the psychologist be prepared for your child to have a sense of what kind of concerns are you having, and how can I target my questions and my interactions with the child based on that information. And so I list two that we often use. The first one is called the BASC, the Behavior Assessment System for Children, and that's a general behavior scale. Are they overactive? Do they seem irritable? Are they anxious? Um, so lots of questions about a broad range of topics. The next one is the Autism Spectrum Rating Scale. And those are more specific, more targeted towards those behaviors of autism. And just to see at what level are you as the parent observing the frequency and intensity of those behaviors. So having both of those filled out ahead of time is super helpful. Like I said here on the PowerPoint, both take about 10 to 15 minutes to complete. So it's not an immediate thing, but filling that out ahead of time would be great. Let's see. So you've been scheduled. The day arrives. You filled out your paperwork. You are getting in the car to come to the appointment. What do you need to come? What needs to come with you um, in order to do the evaluation? First and foremost, I didn't even write it on the slide, is the child. Make sure we do bring that kiddo with you to the appointment. Um, Again, in a general psychology practice, sometimes these evaluations take place over multiple sessions, and maybe the first session you wouldn't bring the child in order just to discuss the concerns. In our sessions that are only over one meeting time, having that child there is obviously super important. Um, but things to bring along with that, first and foremost, are any legal guardianship documents. As I mentioned before, we are required by law to confirm and ensure that a legal guardian is present to participate in that evaluation. That guardian is the person responsible for giving consent and permitting that evaluation to take place, as well as giving consent for evaluation services. I'm sorry, therapy services. You know, sometimes pediatricians' offices and other medical appointments will allow grandparents or aunts and uncles who know the child well, maybe even live with the child, to bring the child to the appointment. Um, at our level of intensity and then also of legal requirement, we do need that parent or legal guardian to be there. And if it's not the biological parent, some documentation will need to be provided to ensure that that's the person who we're talking to. So having that paperwork with us, oftentimes the admissions team, excuse me, the admissions team may ask for that paperwork prior to the evaluation. And so if you've already shared it, that's likely sufficient. But having that with you at that appointment is also very helpful. Other things that documentation that is helpful are previous evaluation reports or any documentation of services from the child's school. Um, Again, we want to have all the information that we can about the child's history and current functioning, and school especially is where the child's going to spend a lot of time. And so any IEPs or behavior reports, even report cards to a degree are helpful to see. And so bringing some of that documentation would be great. Um, we can bring in written statements from other people. If one parent is not able to attend, but is able to provide a written kind of description of behavior is very helpful. And then the practicalities of snacks and diapers and changes of clothes, some of those things that will just make sure that the session runs smoothly. As you prepare for the appointment, there's certain things that we'd love for you to review and have fresh in mind. A big part of what we're going to be talking about is the child's developmental history. We want to get a sense of when did they meet some of these milestones and what's the history of delays. And so knowing, kind of reminding yourself, oh yeah, this is when they did it, or I started having concerns about speech in this area. Being able to discuss that accurately is super important. We'll be asking about medical history. We know physical health and medical history plays a big part in behavior and developmental progression. We'll want to know about any therapy services they've had in the past. Um, we also would love even if they're not able to give written input, excuse me, teachers and other service providers, even if you just talk to them and are able to share during the session what those providers or support staff, what their perceptions of the child are, is very helpful. Then I want to touch briefly on things to maybe leave at home. Again, this is a very much a parent decision. You know your child best and what they need in order to be successful and engaged in any session. So this is just a maybe. Um, we'll say toys from home is a maybe to leave at home during the session, and we'll talk about this in a second. We have lots of available toys and toys that are selected on purpose that help us see certain types of behavior and certain types of interaction styles. And so things from home um, that might distract the child from that, or really, honestly, it's just have the potential of getting lost or forgotten. Sometimes can be a distraction during that time. Now, we'll say there sometimes some of our children get super attached to things. If they don't have their dinosaur figure with them, it's going to be miserable for everyone. And if it's a hardship, just bring the dinosaur and it will be all good. And that's actually helpful for us to see as well. Electronics is another big one. We know how effective they are at keeping our kids in a seat and quiet, and that is an amazing skill. And I couldn't parent my kids without it. Um, but we also want to see how they're engaging again with toys and with people without that super effective distraction. Um, having it available with you, maybe to be in the lobby if we have to fill out extra paperwork, or even to have it with you if during our feedback, like maybe we've finished the session and we're going to be talking about what comes next, having it available for the child then could be helpful. So maybe bring it, but let's talk to your provider in order to decide when to bring that out. Okay. So the day has arrived. You've pulled up or leaving the house. What is that appointment going to look like? The first thing that we ask is come a little early if that's possible. Having additional time for paperwork or just to be familiar with the space is always helpful. Know and anticipate that the appointment is likely going to take no shorter than an hour and a half. We are going to go have a lot of questions to ask and a lot of ground to cover, and it takes a little while to get that information gathered. For some cases where symptoms are less severe or where there's a lot of big things in the history to go over, these sessions can go longer, up to about 3 hours. So again, that's when we start thinking about snacks and who's caring for things outside of the appointment. So just being able to have that time available is super helpful. I list there some different things that we'll do during the assessment, and we'll talk about that here in just a second. Um, we also want you to feel comfortable and know that the goal of the evaluation is to see the child as they are. And so it is okay if they come in and are overactive and loud and make a mess. I always tell my parents this room loves to be messy. So just letting them be as they are. We don't want you to, as a parent, to feel like we have to mask or change anything that they're doing. And so that is all helpful and good information for us. We're going to talk about a lot of things, and I'm not going to talk about each of these things in particular or especially, but each of these areas help us get to know your child a little bit better, and also help to see compare the child's functioning to those symptoms related to autism. So we'll see communication and social skills, patterns of repetitive or stereotyped behaviors. All of these things of general behavior and functioning are the meat of what that evaluation is going to look like. And that's all conversation with you as the parent. There, we want to make you aware there are things that we know affect child's development and behavior that are important for us as a psychologist um, to know and to consider as we think about a diagnosis. So there are some questions that might seem a little sensitive or might seem like you're not usually having to talk about that we might have to ask. Things like guardianship, things like what are the living arrangements? How do we relate to different parenting practices? We'll talk about family history because we know there's a genetic component and likelihood of autism. We want to know what's that history like on the family. We'll also need to talk about traumatic experiences, um, abuse, periods of neglect, things that have been really hard in the child's life, are important for us to consider. And again, just to get to know that child the best. I do need to say in this area, um, we do write a report. So the outcome of this evaluation will be a written document, and the things that are relevant to the child's functioning will be included in that report. Um, that is not to put anybody on blast or to cause any blame. But again, we are trying to know and support that child the best way we can. And so it's important for us to know that if this is big in our child's life, that it's something that we consider. So during the evaluation, we've kind of got these three different types of data that we're collecting. As we said, we have lots of toys available, and a big part of it is as the parent and psychologists are speaking, we get to see some free play from the child. How do they choose to interact with things? How do they choose to interact with the adults in the room? What frustrates them? What maybe makes them really excited? All of those kind of free play activities are really good information. Then there will be a time of guided play. The psychologist may give some suggestions or may model some different activities. How does that child engage with the things that the adult tries to lead them with? Will they engage with the adult at all? All of those things as the adult tries to facilitate the play is good information. And then there will also be the completion of some formal assessments. Some of those are questionnaire based, like a functional skills assessment that we do to help get a sense of that child's functional abilities, but then also some like cognitive ability and what do we get? What's our estimate of their thinking and problem solving skills? And so all three of those things, no one section gives all of the information, and it's all kind of comes together to help us form that overall diagnostic impression. But we're trying to do all kinds of different activities to get a true sense of what that child is and can do. Um, so we've done the evaluation now. You've come, you've met with us. It's been 90 minutes, almost 2 hours. Uh, what comes next? What has the psychologist learned during this time together? Um, Again, things can be run a little bit differently in a community psychology practice versus Complete Kids and other ABA practices. In the community, again, when we're diving really deep and we're exploring broadly, the psychologist is going to need some time to prepare that report and to make a true decision on what that diagnosis might be. Again, when our evaluations are more targeted towards that question of autism, we can provide feedback a little quicker. And so usually, we'd say 9 times out of 10 at the end of our session, we're able to discuss our diagnostic impressions with the parent at the end of that meeting. We will describe how that child's behavior matches or doesn't match the symptoms of autism and kind of what each of those decisions mean. I mentioned again that we will then prepare a report. So with Complete Kids in an ABA practice, you won't have that report available when you leave the session, but that will be prepared later and will be certainly shared with you. Um, it will be shared with you directly, and then you are able to share that with other sources and people who know the child and need that information. And so the evaluation is going to result in 4 different decisions. Maybe everything, according to the psychologists and the way you describe them, seem like things are going pretty well. There are hard days and there might be some differences, but none of it reaches the level of a clinical diagnosis. Maybe there is signs of difficulty and delays, but it's not really autism. They might just be a speech delay. Maybe it's ADHD and we just can't sit still enough to focus and follow directions. Maybe it's an experience of anxiety, like the anxiousness keeps them from engaging socially. And so there is a diagnosis there. And here at Complete Kids, what we like to say is if a diagnosis is clear and obvious, and we have the data that we need to give that diagnosis, we will. We'll sometimes give an ADHD diagnosis or a diagnosis related to cognitive functioning, like an intellectual disability, some language disabilities and delays. Um, but again, our goal at Complete Kids is not to provide that deep and comprehensive. And so you may get to that other diagnosis section and say, it seems to be this, or I'm thinking it's this, but we'll need further evaluation to really decide a formal or official diagnosis in this area. Uh, our evaluation may result in saying, like, yeah, I think this child is experiencing the signs and symptoms of autism, but maybe ABA, and what we're going to talk about here with Ruchi in just a second, is or is not appropriate, and that's not what we need. And so we're going to diagnose as having a autism, but we'll talk about what services are not appropriate. The last section is to say, hey, it seems like this child is showing the signs and symptoms of autism. And as a psychologist, I think ABA could be helpful. And so the psychologist's role is to say, I think ABA could be helpful. Let me get you connected with those professionals that are really good at doing and understanding ABA and help you get pushed along to that next step. So then the evaluation's done and you get to leave and you get to meet awesome people like Ruchi who will hopefully tell you more about ABA.
Thank you, Dr. Wells. That was really informative. And just for everyone who may have joined a little bit later, thank you very much for joining our webinar. This is the first of many series. We just heard from Dr. Daniel Wells, who is our in-house licensed psychologist who assists with our evals. This is recorded and will be sent out at the end so you can go back and check out some things. Thank you very much for your questions. I'm seeing a few of them pop in on the chat, and we will get to those right after Ms. Ruchi, our BCBA in our Burlington location, goes over what happens when ABA is recommended. So thank you, Ruchi. Go right ahead, and you are good.
Thank you, Miranda, and thank you, Dr. Wells, for that informative session on what to do in a psych eval. So now that ABA has been recommended, what do we do? So our admissions team here at Complete Kids will request a prior authorization from your insurance if that's required, and they'll schedule the ABA evaluation in the clinic of potential services. So Complete Kids has locations all across North Carolina, from Gastonia all the way to Rocky Mount. So depending on where you're located in North Carolina, they'll determine which clinic is closest to you and easiest for your child to attend if you choose to do clinic-based services. And we'll talk about that a little bit too. So insurance can take anywhere from 4 to 6 weeks to get approved. So sometimes there's a little bit of a wait, but our admissions team coordinates with your insurance provider and connects with them to get an approval as quickly as possible because we don't want to wait any longer than you do. So now you're here with me and you're being evaluated. What are we discussing? We're trying to decide on priorities for treatment and behavioral concerns in different settings. So, oftentimes, autistic children can struggle with generalization. What does that mean? The idea of doing the same skill in different settings with different people. So, their behavior may be one way in the school setting, and they may act a completely different way when you get them home with you. So, we want to discuss what type of therapy is going to be ideal for your child. Do we want to do home therapy, clinic based services, community therapy, or hybrid? How many hours are they going to be receiving therapy? They have school, they have other services, they want to hang out with their family. We want to make sure that they have adequate time to still be a child as well. And then we want to start to begin to collaborate with other service providers. Do we need the assistance of an OT or SLP, a physical therapist? And maybe we want to include your teachers and the service providers from school as well. Now that we've talked about what we're going to do during the evaluation, what is ABA? ABA is an interpersonal therapy. Your child's going to be typically working one on one with an RBT or a BT, and they're going to be implementing the treatment plan that you and I have just come up with. Our treatment plan is going to consist of things like replacing problem behavior with socially appropriate behavior. And problem behavior includes things like elopement, maybe it's a safety risk, maybe it's functional communication or social skills. We're thinking about coping strategies and helping them regulate their bodies and their emotions, teaching adaptive living skills. And sometimes that's where we're coordinating with OTs on like food exposure or hand washing, maybe toothbrushing and dressing skills. We want to refer to the OT for those fine motor skills as well. And then we want to work on social skills, facilitate interactions with peers, and help them work through cooperative play or initiate interactions. And then for functional communication, we also want to coordinate with the SLP and make sure that we're doing everything that's in the best interest of the child. Maybe that's using an AAC device or sign language. Maybe it's really just honing in on the vocal language and focusing on requesting, labeling, and back and forth conversations. So, those are all of the skills that we're going to cover in ABA therapy. ABA therapy is also going to be individualized treatment. We mentioned that you're going to have your own therapist, your child's going to be working one on one, and that's because each autistic child is different. Just because you've met one autistic person or child doesn't mean you have met them all. So everything has to be individualized. And this is when we're meeting and we're customizing everything to your child. The way that I always explain it to my parents is kind of like a game of Jenga, right? A typically developing kid is learning like a Jenga tower before you start playing the game, right? It's not just going to blow over or fall over because you touch it. Whereas an autistic kid kind of learns all over the place. They have some really, really high skills. They have some really, really low skills that they're missing, maybe. And it kind of represents a Jenga tower when you're almost done playing the game, right? It's almost just going to topple over. And because no two games are alike and no two children are alike, you and I are working together to figure out what pieces are missing and putting back. And our plan is going to be putting back all those pieces to create a strong and stable foundation from your child to continue to learn from. Now, we're going to be also customizing techniques and strategies. It's not a one size fits all approach, and we kind of have to do a little trial and error. Maybe some things are going to work for your child, maybe some things aren't. So, we need to figure out and adjust strategies and methods based on effectiveness and make sure your kid's getting the best therapy possible. And at the same time, we're doing this, we want to promote independence. That's our main goal. We want to list the mastery criteria, and as they master out of skills, we want to keep building and growing because their brains are like sponges, and we want to feed them as much information as possible in early intervention so they can grow to be independent adults. Now, I talked a little bit about some different types of therapy: clinic based, home based, and community based. They're all three options are great, but we need to figure out what works best for you and your child. Now, the clinic based approach is going to be ideal for skill acquisition, right? It's going to be highly structured, predictable, it's a controlled setting, fewer distractions, makes it a little bit easier to acquire skills. Now we're going to also have access to specialized materials, and we're going to group peers in accordance with similar skill levels or developmental age. And then we have collaboration between everyone in the same place. You don't have to worry about communication barriers or anything like that. And most of our clinics are set up to work on school readiness skills, right? The end of the day, we're trying to generalize these skills into multiple settings, and school readiness is a big part of that. And it also makes it easier to collect data and see how the child is making progress. Now, your home-based services, this is where you're really focusing on generalization. I keep talking about generalization because we want them to be able to do this skill in multiple settings all the time with everyone. And with home based, there's a lot of caregiver training too, because you're there able to observe the session. In all of our home based services, a parent or guardian or adult has to be present to be able to deliver those services. This is going to be more in their natural environment, right? It's like their home field advantage. It's going to be relevant to their daily life, and you're going to be able to get involved and participate with the BT or RBT in implementing this treatment plan. It's also going to help you with your routines, your meals, your bedtimes, your transitions. Maybe you have an older learner that's working on doing chores, maybe putting the dishes away, making their bed. Those are all great skills to learn to be independent. This is also great for early learners who have significant support needs. Maybe your kid has a high safety risk, or maybe they're head banging and you've already set up the environment to be safe for them from getting hurt. And it also reduces a transportation burden for a lot of families. Sometimes it's hard to get out of the house with your kid that has so many special needs. Maybe it's taking them out of their routine that makes it harder for them and you. So home base is another option that we offer. Then we have our community-based services. This is where we're really honing in on that independence and real-world access. We're going to practice those real-world skills that we've learned in the clinic. Maybe we've tried to generalize into the home setting, and now we need to get out into the real world and practice and make sure that we can do these skills all the time. This really strengthens that generalization again and creates a maintenance of skills. Now it's in our back pocket and we have this skill and we want to use it in the environment. It's going to be great for social skills. You get to interact with a bunch of different people. Maybe you'll get introduced to other support groups and things like that. It also works for safety skills. Maybe we're learning to cross the street, look both ways, things like that. Maybe not run around in parking lots, that elopement aspect we talked about, and independence overall. Maybe they're getting older and learning how to shop in a grocery store or check things off a grocery list. And it helps them build confidence in natural environments for skills that they've been practicing. And we want to really support inclusion too in typical peer settings, and all those social skills that they learned. We want to help generalize them as well. Now, we're transitioning to school, right? The clinic is a controlled setting. Maybe you chose clinic-based services and that's where you started. That's a controlled setting. They're going to be one-on-one. In a school setting, that's going to be a little bit different, right? I wish every student could have a one-on-one teacher, but unfortunately, that's not the case. And we love our teachers and we want to make sure that they're able to support all of our children that are learning too. But because it's a control setting, we can make changes and implement strategies on a whim, right? We want to use our evidence-based practices and make sure that we're doing our best to support the child. This also allows us to practice with that school routine. We mentioned our classrooms and kind of kids being moved around based on developmental age or skills that they're working on. This allows us to practice a routine. Maybe we're going to recess, maybe we're doing lunch and circle time, and getting them comfortable with those routines that they would be experiencing in a school setting. It also allows us to discover probable barriers to learning in school. Are they getting distracted really easily? Are they fidgeting? Are they, upside down in their chair because they can't sit still? Do we need accommodations like maybe a wiggle stool or a cushion in their chair? Do they need frequent breaks or maybe a little sensory toy to keep them engaged when they're learning? So we can identify these barriers early and go ahead and help teachers write it into their IEP and get to know the child to ensure success at school as well. And then we are collaborating with the community, right? Community-based services, we are getting speech, we're getting OT, we're getting PT if it's applicable. Each child is going to be one-on-one with the therapist and with their speech OT or PT, but we also co-treat. So our RBTs and BTs will go in there with speech OT and PT and help the child stay focused, help them implement the strategies that they're trying to implement. And we'll also collaborate with the BCBA to kind of translate some of those goals that they're working on in those therapies and practice them throughout in ABA as well. Because oftentimes you're getting speech for 30 minutes or OT for an hour, physical therapy for an hour, and that doesn't really leave a lot of room to practice those skills. Now, if they were at home, you would be doing it with them. But because they're going to be spending a large chunk of time at ABA, we can help you too. We're also working with teachers and parents. I mentioned IEPs. We want to kind of troubleshoot together and figure out what works. That generalization again, maybe they haven't generalized the skills yet, and they're telling the teachers they know different skills, or they don't know certain skills that they're showing us that they do in ABA, or maybe they're showing us that they do at home. So we want to collaborate and make sure everyone's on the same page and the kids aren't pulling one over on us. Now, there's different interventions that we can use in our treatment plan, but the most important thing is we want to use evidence-based research and positive reinforcement. Reinforcement procedures are going to be the most effective when we're trying to teach our littles. And the other thing is to use antecedent strategies, right? We don't want to we don't want to constantly tell kids that they're not doing the right thing, or we're trying to redirect them once they've already done something that wasn't ideal in that situation. So we want to focus on our antecedent strategies. So before they even think about having a behavior, or before they even think about getting into a tantrum, we're going to tell them, hey, we're going to try this, and then you're going to get what you want. So we're priming them and letting them know, like, you're going to get what you want, but first we got to do this. We just got to wait a little bit. You also want to kind of figure out preference assessments. Are we going to play with this? Are we going to play with that? If they're not motivated to do what you're asking them to do, you're likely going to result in a tantrum or a problem behavior when they're trying to communicate that that's not what they want to do. We also focus on behavioral momentum. We don't want to start with really, really hard tasks first. I don't want to do really, really hard tasks, and I'll kind of ease myself into it as well, where I start with a bunch of little things that, make me feel good about completing things. And then I'll work on something that's a little bit harder that maybe takes me a little bit more time. Same thing with the kids. If they're working on something difficult and you're constantly telling them, no, that's wrong, let's try it this way, let's do this, that's going to be really frustrating, right? They just want to be done and they want to get access to their reinforcer. So we start with easy tasks so they can get access to reinforcement, and then make it difficult slowly to kind of ease them into it. Sometimes kids are visual learners and visual supports are really important. A token board or a visual schedule, maybe a little chart, or a daily chore list if they're a little bit older, those are super helpful in helping them complete their daily tasks. Now, our consequence strategies, when sometimes behaviors happen, our consequence strategies that we have to use are positive reinforcement. We've talked about it a little bit, but that's, providing them praise or tangibles after we complete tasks. Now, when we're praising them, we don't want to just say good job. What are we saying good job for? The child doesn't understand what skill is being reinforced. So we'll say something like, hey, great job taking deep breaths and calming yourself down. Great job walking to the car. And you really want to highlight the skill that you're reinforcing, because maybe they're not making that connection to the skill that we want to see, but they're making the connection to the skill we don't want to see. Maybe it's, hey, good job for having that tantrum. And then you start to see an increase in that. So it's really important to highlight behaviors that you want to see more of. We're also going to redirect them when they're not engaging in the task we want them to engage in, or if they're doing something that's possibly unsafe. And then differential reinforcement, we're teaching replacement behaviors, right? Now, if we're just telling a kid, hey, don't do that, well, how are they going to learn to do something different? We have to teach them, hey, instead of, having a tantrum because you want access to this toy, just ask me, I want the car or car. And we'll work with the SLPs to make sure that they're able to communicate in a variety of different ways and have access to communication at any given moment. And then you also have like your error correction and errorless teaching as well. Each plan is going to be different depending on your child and what you as parents value and what skills you guys are working on too. Now, prior to the start of ABA therapy, your admissions department is going to contact the insurance company and make sure appropriate approvals are in place. You don't want to have to pause services once you've started, and to be able to get acquainted with the clinic and therapists, you can always come in for a clinic tour and get to know everyone a little bit. You'll meet the office manager, the front desk, and some of the other therapists and your BCBA as well. You'll get a feel for the location and the environment that your child's going to be in, and we'll get you access to all the great resources that will be available to you and your child now that you've been diagnosed with autism. Once you've been confirmed to have coverage from your insurance company, we'll go ahead and start you for your first session in the clinic, and we'll talk a little bit about what you should bring, what you should pack. This is one of my most asked questions. Okay, I know what ABA is. I know what they're going to be doing here. What do they need? What do I bring? Well, a water bottle first, because they're going to be running around a lot. They're going to be playing and running. And if water's not something that your kid prefers to drink, maybe you want to bring like a juice or something too, to make sure they have all their favorites. If they're still toilet training, maybe you want some pull-ups. A lot of our clinics will ask you if you want to leave extras in the clinic so that you don't have to leave work in the middle of the day to bring an extra pull-up or anything like that. And maybe some extra outfits if there's an accident or anything like that while they're potty training, or just, they spill some juice on themselves or something like that. Lunch and snacks, we want to make sure that they're well fed so they don't get hangry and they're able to stay focused when they're learning. You're welcome to leave extra snacks in case there's a day that they're just a little bit hungrier or they're growing really quickly and they just are eating everything in sight. There's also microwaves and fridges available in all the clinics. So if your kid only eats Hot Pockets or things that need to be heated up, they'll be able to do so. And then some kids are, they're not eating solid foods yet. Maybe they're still on like pediatric or milk, things like that. There's a fridge available to make sure that those drinks aren't getting spoiled too. And most of our clinics, if not all of them, are nut-free facilities to protect those with allergies. We have staff and children in clinics that are allergic to nuts and things like that. We want to make sure that they're protected, and if they go to school, we want to make sure that they're able to kind of have a food repertoire that doesn't include nuts, to protect them as well. Now, if they have an AAC or communication device, you want to be sure to bring that too so they can have access to their words and their voice when they're in therapy, and the Cure app too. So, in the Cure app, once you've gone through all these appointments with Dr. Wells and you've come and seen me, and now you're starting ABA, you'll be able to see their kid schedule. You'll be able to see what therapists they're working with, and the therapist will write updates about your child's day. We worked on these skills. This was their mood. We had a little bit of a tantrum, but we were able to redirect by doing XYZ. And overall, we had a great day. Or maybe there's some skills that we're working on and the day could have been better. Um, if you don't have access to the Cure app, let us know and we will definitely help you get set up. And the other thing is schedule parent trainings. The more involved you are, the more progress that you'll be able to see, because we're all going to be on the same page and doing the same thing. You'll also get to observe therapy sessions, to see what that looks like in a controlled setting and see if your child is behaving differently in therapy versus at home. Maybe they're showing us skills that they're hiding from you at home, so you can keep doing it for them. Um, and I think that's it for me. And we're back to Miranda.
Thank you very much, Ruchi. I appreciate you guys so much. Being able to hear the back end, how you begin, and then also someone who's in the clinics with the kids every single day is so important. And I know as our future parents, that first step can be very daunting, and to demystify it a little bit, break it down to these small little steps, like you talked about, Ruchi, feels so good to be able to accomplish here, here, and here. And education is always that first step. So thank you guys so much for being our speakers and our representatives. I couldn't ask for better reps for Complete Kids, truly. Just some general housekeeping, and then we do have a few questions in the chat. So For our wrap up, we will be hosting additional webinars. If you've signed up for this one, you will most likely get notifications as those come out. Those will be revolving all of our services and just general parent education. So you may want to keep your antennas up for those. Again, thank you all for attending. And just know if we didn't address anything today that you maybe think about later on your journey, feel free to reach out to us. I'll send some contact information with this video when it all comes out to you all. So I did have a question from Miss Kelly. She says, my son has an appointment on the 6th of January. It's coming up very soon. And I've asked the school to send me all the documents since starting school, having trouble receiving them. Christmas break is coming up soon. Dr. Wells, do you have any insight?
Yeah.
How can we assist that?
So all schools are required to provide parents with their documents upon request. So I'm sorry that the school isn't following through on that. Usually, I know sometimes it takes showing up in the office and saying, "I'll sit here until they can get it." Important positions and people to know in the building. Obviously, your child's special education teacher or EC teacher is going to be the person who kind of manages that data. Each school also will have a compliance coordinator who is also able to access and print out that data. So if the EC teacher is not there, you can say who's the compliance coordinator, and that person can print it out. Um, as far as we are concerned, emails of IEPs are also sufficient. You can forward that email to us. You can just show it on your phone, or we can get it printed out in the copy, or I'm sorry, in the session. So a couple different ways. There's also district level staff who can help. So if you feel like the relationship at the school is a bit deteriorated, people with the Department of Exceptional Children in each county will have people who can access and print documents as well. So those contact information would likely be on the county's website.
Okay, awesome. Thank you, Dr. Wells. The next question is, will you be able to diagnose more than just autism during the evaluation? You may have touched on this, but if you could go
Yeah.
further.
Yeah. So, like I said, if things are clear and obvious, there are lots of situations where kids may come in with diagnoses from a previous evaluation or a pediatrician, and we can say, yeah, that diagnosis makes a lot of sense. I have the data and the observation to also provide that diagnosis. Um, because of our population, the younger kids that we're typically seeing, some of the diagnoses like a developmental delay or an intellectual disability, even ADHD to an extent, are things that we can provide pretty clearly and confidently. One brief note about ADHD in particular, one of the diagnostic requirements is evidence of the behavior difficulties across settings. So let's say you're telling me at home they're off the wall, and they can't focus and we're not getting anything done. Then they come in and they have a really good day in the evaluation, and I say I can't see I can't see the off task behavior, and then I don't really have any information from school. So I don't doubt you, parent. I don't I believe you that they may be really difficult to manage. I just don't have the opportunity to see that or confirm that in a way that ethically meets that diagnosis criteria. And so that's something I might have to postpone for later. So certainly other things you can leave the session having diagnosed, and we can talk about that. And our psychology team are all trained psychologists. So like if given the appropriate time and information, we can all provide those diagnoses. It's just whether or not the setup of our evaluation standard practice allows us to have the information that we would need.
Okay, great. Thank you very much for that.
Mhm.
We are pretty much out of time. We did good starting 5 minutes later and ending 5 minutes after. So perfect, you guys. I appreciate you again. One last look, I'm going to show just the process at a glance, and then we will go ahead and cut and say thank you for being here today. So, very quickly, once your referral is received, either two worlds, right? You're either already diagnosed by an outside entity or Complete Kids, our wonderful Dr. Wells or whomever is in that area will do the diagnosis. If you are suggested for ABA, you will continue on to your ABA evaluation, where then you will be connected with the family and the clinic of your house. So where you are evaluated may not be the clinic that your child goes to, but you will then be connected, meeting the office manager and your team from there. And that's where the fun begins. So the goal is graduation, and the goal is a wonderful, wonderful team that makes everyone feel like you have a village. Thank you guys very much for being here. Again, this will be recorded. The rest of the questions or anything else will be included in that recording sent out to everyone. And we appreciate you guys so much. So I hope everyone has a great rest of your day. And again, feel free. Any further questions throughout this journey, send our way. All right. Thank you guys. Thank you, Dr. Wells and Ruchi. Appreciate
Yeah.
you guys.
Thank you so much for having us.